Hey everyone, Dr. Charlie Johnson, physical therapist and back pain specialist. I'm here to talk about spine surgery. So spine surgery is a big business. There are a lot of surgeons and hospital systems making a lot of money off this very useless surgery. In fact, we know that only about 1 to 2, maybe some studies show up to 5% of spine surgeries are actually needed. And a lot of people come to me thinking that spine surgery is like the pot at the end of the rainbow, that if they do X, Y, and Z and it doesn't work, then they can fall back on surgery and that's going to be the solution. But we know that in 95% of cases, spine surgery is no better. In fact, results in worse side effects and often second surgeries than if somebody just gets physical therapy. So no better than conservative natural treatment in 95% or more of cases. So before I share sort of when it's needed, my name is Dr. Charlie Johnson. Again, I help people get back to normal without pills, injections, and for sure by avoiding surgery. For anybody out there who's has specific questions or is interested in a non-surgical second opinion, completely free, no strings attached, I'm passionate about this, I want to help people, call 484-552-3767. So, when is spine surgery needed? The primary indication for when we want to do spine surgery potentially is when there's a clear and progressive, meaning it's getting worse and worse, loss of nerve function, meaning the nerve is very unhappy and it's losing the ability to allow you to feel, or it's losing the ability to send signals to the muscle which allow us to move. So loss of feeling or movement, strength. That says movement. And sometimes bowel or bladder loss. So if somebody's wetting their pants, saying that their foot is dragging and it's getting worse, and then they can stab themselves with a pin or a pitchfork and not even feel it, those are the indications. Now the cool news is, for anybody watching, this is only 1 to 2 to maybe 5% of cases. Otherwise, surgery for people who just have leg pain, sciatica, or back discomfort, no better than conservative treatment. So take even the worst cases of people who have raging leg pain so bad they want to cut their leg off, but they don't have loss of bowel or bladder control, their leg feels funky but they're not losing feeling, true feeling, and they're not dragging their foot and having any signs of terrible weakness. What we did is, I have a little graph here, if you will. This is time and this is pain. 0 to 10, 10 is the worst ever. This is 12 months. What we did in this study is we said, all right, these people with really bad leg pain, let's see the effect of surgery. And we're going to look at 12 months. We're going to compare surgery to no surgery, physical therapy. What we found is that the surgical group felt better a little bit quicker, and the PT group took a little bit more time, but comparable at 6 and 12 months as far as outcomes. So just to summarize again, spine surgery is very rarely needed. In fact, maybe 1 to 2 to 5% of cases if there's damage, true damage to the nerve. How do we know this? We can't feel specific things. It doesn't just feel funky. We can poke you with the pin and you don't feel it. If there's an inability to go up on the toes or the foot is dragging, we can't say walk on the heels. These are signs of nerve damage, or if there's some type of bowel or bladder loss, issues with control there. So those are the signs of when it is needed. And we looked at people who just had pain and said, well, is the primary indication of surgery pain? And we found that no, it's not. In fact, the outcomes at 6 months and a year for people who even had the worst leg pain were exactly the same. And obviously there's no adverse side effects to a natural treatment program. If anything, we learn more. We can learn to prevent these problems in the future, provided the tools, knowledge, and understanding that are given by a top-notch physical therapist. So for anybody out there who's watching, hopefully this was valuable. Like, comment, or share. Help me spread the word, please. And or call 484-552-3767 with questions or for a free, no-strings-attached, non-surgical second opinion. Thanks, everyone.